Hey guys, Dr. Tobisch here again with Whitefish Chiropractic. Lately we've been talking a little bit about sciatica and different conditions that can cause sciatic symptoms, so we figured this would be a perfect time to give you guys a little sneak peek at one of the most useful tools that we use to assess and treat patients when they come in with sciatic symptoms. And that technique is the McKinsey method, or MDT, which stands for Mechanical Diagnosis and Therapy. We use MDT for a lot of different conditions throughout the body, but we find it to be extremely useful in the assessment and treatment of patients with things like lumbar disc problems and sciatic symptoms. A big part of the basis of this technique is that a lot of the pain and musculoskeletal conditions that we develop are mechanical in origin, meaning that excessive or abnormal forces on different tissues or parts of the body is oftentimes what causes our pain. So if certain forces in certain positions is what's causing our pain, it's pretty logical and reasonable to think that we may be able to find alternative forces in different positions that may relieve our symptoms. And that's a lot of what we're doing when we use this technique. So to go through a simple example, previously we had talked a little bit about these disc problems where the lumbar disc is the material's moving backwards and runs into one of these nerves, which gives us those symptoms down the leg. So if we're sitting slouched for long periods, using our back instead of our legs to pick things up, our lumbar spine keeps rounding into flexion more and more, and we start to get this disc material that migrates backwards. If it runs into one of these nerves, oftentimes that produces the symptoms that we feel going down the leg. So if a lot of flexion and rounding in the low back is what caused our problem, oftentimes if we can find ways to extend the patient's spine and move in the opposite direction, we relieve the pressure on the disc, take the pressure off the nerve root, so we'll be able to give this patient certain movements and exercises that will give them some relief. It also helps us figure out what positions we want the patient to be in and which positions we want them to avoid, which is a great start down their road to recovery. So next up, we're going to go through a little mechanical assessment of the lumbar spine, and then we'll look at some of the McKinsey treatment protocols. All right, guys, next up we're going to be going through a little mechanical assessment of the lumbar spine, which means we're basically going to be moving our patient around in a bunch of different directions. We're going to see which ones are painful and limited. Like we said before, if we can find the forces and positions that produced our patient's pain, that can give us a good idea as to how we need to move them to start relieving their symptoms. So we're going to have Annie going through this mechanical assessment. Initially, we're going to do some side glides. So we're going to have you go arms here, and then we're going to shoot your hips off to the right as far as you can. Perfect. And then go the other way. Next up, we're going to be looking at rotation. So give yourself a little hug and then rotate as far as you can to the right. And go over to the left. And come on back to the middle. Next, we're going to look at flexion. So we're going to have Annie bend down like she's going to touch her toes. And typically, if we have this posterior disc problem, a lot of times this is going to be pretty painful and it might increase the symptoms down the back of the leg, which brings us up to another topic of centralization and peripheralization. So peripheralization means that things are getting worse. So if our problem is caused by flexion and we make Annie bend over and flex her spine, like we said, a lot of times that'll make the symptoms worse. It'll make the symptoms go further down the back of her leg. So if we know that flexion's making her worse, that tells us that if we extend her, she's probably gonna get better. But we're gonna have her do an extension here, just reaching out towards the sky and extending backwards. And come out of that. That one is actually also typically the most limited, and it's also painful. But next up, we're going to go through some of the treatment strategies associated with these posterior lumbar disc problems. For our example, we're saying that our patient came in with sciatic symptoms down the back of her leg behind her knee. And when we were going through our mechanical assessment, we made her flex forward like she's going to touch her toes. That made her symptoms worse. It made her symptoms peripheralize or go further down the back of her leg, which told us that we may need to try to extend her spine to try to relieve her symptoms. So we're going to have our patient go into one of the positions that we start in, which is called prone on elbows. So she's just going to be propped up on her forearms like a little kid watching TV. From here, we may hang out here for 3 to 5 minutes, just having the patient working on breathing into their belly, and we're trying to see, do we start to get any centralization? Do her symptoms start coming up out of the back of her leg and getting closer to her spine? So say we hang out here for a minute or two and we start getting some centralization. Maybe your symptoms move from behind her knee up to her glute, and then they just kind of stay there. Things get stagnant. So now we need to progress our forces. So we're gonna have her do some prone press-ups where she's gonna be leaving her hips down on the table, then just doing an upper body push-up. So here, we're just creating more extension in the low back, trying to move that disc material back forward to take pressure off of the nerve. So Annie will knock out a couple of these press-ups, And say from here, now her symptoms move from her glute all the way into her spine where our problem's actually occurring. This is a great sign. That's a green light for us. Now we know what we need to send Annie home with and what positions we want her to avoid. All right, guys, that was a little glimpse at an extremely powerful technique known as the McKinsey method that we use here at Whitefish Chiropractic. If you're dealing with any sciatic symptoms that you can't seem to get rid of, we would love to help. So give us a call at 406-862-2121 or find us online at whitefishchiropracticcenter.com to schedule your appointment today.